Hello and welcome to my channel, Boo Snakes and More. For more videos like this, you can also watch my other house channel, A&A Snakes and Stuff, my youngest son's channel, He Needs Toys and Games, or my oldest son's channel, Little Chris 10. Today we're going to be talking about cannabis, so please like this video and subscribe to the channel. Now let's dive in. As cannabis legalization becomes more prevalent, research into its various components and their effects on the human body, including anxiety, has gained momentum. A recent study led by a research team from Johns Hopkins Medicine has shed light on the potential of a naturally occurring chemical in cannabis called D-Lumina, Cannabis and Anxiety. The study was conducted by Troy Spindle, PhD, an associate professor of psychiatry and behavior sciences at the Johns Hopkins University School of Medicine. He and his team aim to investigate the anxiety-reducing effects of D-luminol in humans when combined with tetracannabinoid THC, the primary psychoactive component in cannabis. Ryan Vander, PhD, a professor of psychiatry and behavior sciences at the Johns Hopkins University School of Medicine, was the senior author of the study. He explained people use cannabis to help reduce anxiety, depression, and post-traumatic stress disorder. But since THC levels vary widely if a person overshoots their tolerance of THC, cannabis can induce anxiety rather than relieve it. Vandelity continued, our study demonstrates that D-Luminar can moderate the effects of THC in a meaningful way and make THC more tolerable to people using it for both therapeutic and non-therapeutic purposes. The rise of THC levels in cannabis. In recent years, selective breeding of cannabis plants has resulted in strains containing upwards of 20% to 30% THC, compared to an average of 12% a decade ago. This increase in THC levels can make it challenging for users to consistently consume the same amount of THC on each occasion. THC interacts with receptacles in the brain to produce feelings of relaxation and euphoria. However, when a user is exposed to higher than usual doses of THC, the drug can also trigger anxiety, fear, and panic. Promising role of D-Lumina. D-Lumina, one of the most abundant terpenes and essential oils in the cannabis plant, has shown promise in rodent studies in reducing anxiety behaviors. Terpenes are responsible for the taste, aroma, and color of plants. In the study, 20 healthy adults participated in up to 10 outpatient sessions, during which they inhaled vaporized D-Lumina alone, vaporized THC alone, vaporized THC and D-Lumina together, and vaporized distilled water as a placebo. The study was double-blinded, ensuring that neither the researchers nor the participants knew who was receiving which mixture. How D-Lumina from cannabis impacts anxiety. The research team concluded that comparing D-Lumina with THC significantly reduced subjective indicators/reports of THC-induced anxiety in participants. These reductions were greater as the dose of D-Lumina was increased. Additionally, they observed no interference with THC's subjective, cognitive, or psychological effects when co-administered with D-Lumina, as well as no effects from D-Lumina alone that differed from the placebo test. Dr. Splendor, the lead author of the study, states this study is a first step in uncovering how we can mitigate risk of THC when used in medicine. And also was targeted at making cannabis safer for the general non-therapeutic consumer. The researchers plan to continue experimenting with other terpenes alone and in combination with THC to see how they interact with each other, as well as replicate the D-Lumina study in larger and more diverse clinical populations. They also plan to test alternative methods of administration, such as oral ingestion, exploring the therapeutic benefits of cannabis. As mentioned previously, cannabis has been gaining recognition for its potential therapeutic benefits as research continues to uncover the medical possibilities of this versatile plant. More people are turning to cannabis as a natural alternative to traditional pharmaceuticals. Pain and inflammation management, one of the most well-known therapeutic applications of cannabis, is pain management. The cannabinoids found in cannabis, particularly THC and CBD, interact with the body's endocannabinoid system to reduce pain precipitation. Many patients suffering from chronic pain conditions such as arthritis, fibromyalgia, and neuropathic pain have found relief through the use of cannabis-based products. Cannabis also possesses potential anti-inflammatory properties. Inflammation is a common underlying factor in many classic diseases, including autoimmune disorders and neurodegenerative conditions. By targeting inflammation, cannabis may help alleviate symptoms and slow disease progression in conditions like multiple sclerosis, Crohn's disease, and Parkinson's disease, alleviating anxiety and depression with cannabis and D-luminol. The cannabinoids in cannabis have been shown to interact with the brain's receptors that regulate mood and emotion. For individuals struggling with anxiety and depression, cannabis can provide a natural alternative to traditional antidepressants and anti-anxiety medications. However, it is crucial to find the right balance, as high doses of THC may exacerbate anxiety in some individuals. Cancer treatment and sleep quality. Cannabis has shown promise in supporting cancer treatment by reducing the side effects of chemotherapy, such as nausea, vomiting, and loss of appetite. Additionally, some studies suggest that certain cannabinoids may possess anti-tumor properties, potentially slowing the growth and spread of cancer cells. Many people struggle with sleep disorders such as insomnia, which can have a significant impact on overall health and well-being. Cannabis, particularly strains with high CBD, can promote relaxation and improve sleep quality. By addressing sleep issues, cannabis may indirectly contribute to better mental health, pain management, and immune function. Implications in future D-luminol studies. In summary, D-luminol, a natural chemical found in cannabis, shows great promise in reducing the anxiety-inducing effects of THC. The Johns Hopkins Medicine-led study provides evidence that combining D-luminol or THC can make cannabis use safer and more tolerable for both medical and recreational consumers. As researchers continue to explore the interactions between terpenes and THC, as well as test alternative methods of administration, is an important finding. Paves the way for more effective and personalized cannabis-based treatments. By unlocking the potential of D-luminol, we take a significant step towards harnessing the benefits of cannabis while minimizing its risk. The full study was published in the Journal of Drug and Alcohol Dependence. Thank you for watching this video, and peace out till the next one.